Okay, well, welcome back. Today I want to talk to you about how to manage your blood sugar regardless of the type you've been diagnosed with. First, I want to go over the different types of diabetes. There's a lot more than you think. It's kept changing over the years. It used to be juvenile diabetes and adult onset diabetes. That is no longer the case. Juvenile diabetes is type 1, and now even adults are being diagnosed with type 1. Adult onset is type 2 diabetes, and that is also being diagnosed in young children. There's also gestational diabetes, which of course can occur during a pregnancy. Most times it goes away after the pregnancy, but then you're at more risk for developing type 2 afterwards. There's also type 3, and that is also known as Alzheimer's or dementia. And that's basically the brain can't process the sugar as a fuel anymore. The brain is insulin resistant. So that's how dementia and Alzheimer's develops. And now there's a few more. When I went to, there's a diabetes site from the UK, and they list a lot of different types, different categories of diabetes. There is steroid-induced diabetes. Yes. When I worked in veterinary medicine, every time there was an animal, a dog put on prednisone long term, they almost always became diabetic. It just happens. So that can happen in people too. There's also LADA, which is, I have to read this, latent autoimmune diabetes of adulthood. It's also called type 1.5. So it has characteristics of both type 1 and type 2. It can get even more complicated than that. There's even a listing for double diabetes, which is a type 1 who has become insulin resistant. So imagine if somebody's diagnosed with type 2 and their medications aren't working. Maybe they need to be retested, make sure that their body's producing insulin at a normal rate for type 2, just to check. Maybe they are a type 1 or a type 1.5. So if patients were treated according to these different types of diabetes, imagine how much care would improve. But let's talk about managing. Self-management. Because regardless of what type you have, self-management is key. And self-management means testing. You have to test. When I was pricking my finger, I would do it 6 or 7 times a day. Now, I'd like for people to test often, not just once a week or once every doctor's visit, because you're not getting a whole picture of what's going on in your body. If you're only getting your A1C tested every 3 to 6 months, you're not getting the big picture. You have no idea if your medication's working, how food's affecting you, stress, medication, illness. It all has an impact on blood sugar. So you have no idea what's going on in your body. Now, say you're only testing once a day. That's fine. But try testing the same time every day for a week. The following week, test at a different time and keep changing that up. That way, you're getting a bigger picture. If you're testing only before bed, you're just getting another small glimpse. If you're testing an hour or two after a meal, then you're able to see how that food is affecting you. If I eat any rice or potatoes or anything, my blood sugar spikes. Other people, it doesn't do that. Everybody is different, so you don't know how food is affecting you. You may have a cup of rice and it not have any impact at all and not be great. But for some of us, it does make a difference. So I really, really, really encourage people to test to manage themselves at home much better. Now, if you don't like pricking your finger, and there's a lot of you out there that don't like pricking your finger, I understand. There is something called a continuous glucose monitor. It only sticks you once, and it can last up to 14 days, depending on the brand. And I love it. You can just, if you're using one of the brands, you scan it, and it shows you your levels. And the good thing about the continuous monitor is that it tells you what direction you're going in. It can tell me whether I'm starting to have a low or starting to go up a little too high. So I can make corrections before it becomes an issue. So that's a lifesaver for me. But we'll talk about more of the CGMs at a later date. I just wanted to throw that out there. There are ways to do it. I just encourage you to test. You can live a healthy, long life with diabetes if you manage it properly. And the best way to do that is to test it. And that, when you test and write things down, then you can share that information with your doctor. So adjustments can be made to your medications or your dosage, or even sometimes you can be taken off medications. But you can only do that if you show them your numbers. So please check your blood sugar regularly or get a CGM. All right, so that's all I've got for you today. Just remember to like and subscribe below. Ask questions, comment, and I'll see you next time. Have a happy and healthy day. Bye.